Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with a COVID-19 update for Simcoe Muskoka. We continue to have reduced ability to report on cases related to the change in the testing approach, but also just the volume of cases that we are receiving, and challenges with regards to even capacity to keep up with data entry. So it is likely that starting next week, we will not be able to report separately on the case count in Simcoe from Muskoka. It would be for Simcoe Muskoka as a whole, and we wouldn't be able to post the number of individuals as part of outbreaks on our website either. So at this point in time, to date, we've had a total of 33,078 confirmed cases of COVID-19 in Simcoe Muskoka, and this is up 1,047 since February the 2nd, the last time that I reported. And in the past 24 hours, we've had 185 cases. We actually are noting that the number of cases we've had in the fifth wave is almost as many as all of the other waves combined to date. And so it's quite possible that as the fifth wave continues, it will exceed the number of cases that we've had in all the previous waves combined. We've had 88 deaths so far in the fifth wave over the last 9 weeks, which is the second highest number of deaths we've had among any of the waves to date. Wave number 2 had a higher number of deaths, 154 deaths. But wave number 2 was longer in duration than so far the wave that we're in right now, wave 5. So on a week-by-week basis, we've had a higher number of deaths in the fifth wave than in that second wave or any other wave. We've had on average 10 deaths per week as opposed to 6 deaths per week during wave 2. And we've had a higher hospitalization rate in the fifth wave compared with the previous waves as well, with a weekly hospitalization on average of 25. We are seeing a decline in our case count and in our percent positivity. And so over the past 3 weeks, we've had a reduction, as the province had a reduction in case counts. There's also been a reduction in hospitalizations, but some increase in intensive care unit occupancy in Simcoe Muskoka. And the number of deaths continues to be high, increasing in the fifth wave in Simcoe Muskoka. Most of them related to institutional outbreaks. So we've had a 31% reduction in our case count over the last week, down to 948 cases in the last week, as opposed to 1,365 during the week of January the 23rd to the 30th, and giving us now an incidence of 157 cases per 100,000 population for the week. And the province, too, has had a similar degree of reduction, a 30% reduction over the past week, and has an incidence that is at 146 cases per 100,000 population per week, so slightly lower than our incidence at this time. The 27% of our cases over the last week were unvaccinated. 69% had 2 or more doses of vaccination, and 4% were partially vaccinated, a single dose of vaccine. And a significant number of our cases have actually occurred among people who've had a booster dose, 3 doses. So 277 cases, or 29% of our cases actually occurred among those who had had 3 doses of vaccine. I will speak a little later to the importance of vaccination and the degree to which it helps reduce hospitalizations, ICU admissions, and deaths. But despite that, we are seeing quite a substantial number of breakthrough cases among those who are vaccinated. And this just speaks to how transmissible this variant is, and the fact that we have seen some reduction in its effectiveness in preventing transmission. And there's still a high degree of protection against hospital admissions, although certainly not perfect. We're still getting some hospital admissions and deaths occurring among the vaccinated as well, but the likelihood for an individual is greatly reduced. If we look over the past week, 10% of our cases were among children under 12 years of age, and 15% were among people above 65 years of age. And as I was saying before, vaccination is helpful, very helpful for reducing severity. So for those who are unvaccinated, they're 5 times more likely to be hospitalized, and 10 times more likely to be admitted to the intensive care unit, and 3 times more likely to die compared with people who've had 2 or more doses of vaccination. We know that 3 doses is that much more protective than 2 doses. So for people who have had 2 doses and are eligible to receive a 3rd dose now to get your booster, we certainly urge you to do that. We have lots of capacity in our vaccination clinics to allow that. People can book, but they can also do drop in. We can accommodate drop-ins for that, and certainly urge people to receive vaccination that you're eligible for. Our percent positivity has gone down slightly to 12.8% from 13.2% over the last week. So not coming down quickly, but coming down. And in terms of hospitalization, as I'd indicated, we've had some reduction in hospitalization down to 44 at present from 61 a week ago, but an increase in ICU occupancy at 10, down from 4 a week ago. And we do note that those who are above 50% make up the great majority, 87% of those hospitalized in Simcoe-Muskoka, among people from Simcoe-Muskoka. 34 of these admissions are people from Simcoe County, and 8 people from Muskoka. 2 we don't know. 6 of them are associated with institutional outbreaks. 38 are sporadic cases from the community. 43% of them, or 19 of them, have no record of vaccination, so not vaccinated. And 45% of them, or 20 of them, have had 2 doses of vaccine, 1 single dose of vaccine, so partially vaccinated, and 4 3 doses of vaccine. Half of the people, 5 of the 10 in the intensive care unit, have received vaccination, 2 doses. So it is very important for those who are vaccinated, for everybody, including those who are vaccinated, to continue to follow all the protective measures, the multiple layered approach to protection. So the mask use in indoor public spaces, workplaces, outdoors, if in close proximity to other people, a good quality mask, physical distancing, hand washing, and self-monitoring and isolation if you develop symptoms. Obtain a test if you can, and seek medical attention with severe symptoms. So all of that is very important, continues to be important, and that is true for those who are vaccinated as well as those who aren't. Vaccination is the single most important thing that you can partake of to protect yourself and to protect others. We have had an additional 27 deaths over the past week, and I would like to express my condolences to the family members for your loss. So this takes us up to a total of 380 378 deaths to date in total. And the ages of those who passed away over the last week range from in their 30s to more than 100 years of age. So we have had two individuals in their 30s pass away, both sporadic cases not associated with an outbreak. We've had 18 men and 9 women pass away, 3 from the Muskoka 24 living in Simcoe County, and 14 of these are associated with outbreaks. I don't actually have data at this time about their vaccination status. So we do have, if we look through our outbreaks associated, mortality associated with outbreaks in the present year, 2022, 54% of them were associated with institutional outbreaks. So that's a total of 87 deaths. We do note that that figure has changed over time. So if we compare the waves and the proportion of those who passed away who've been part of institutional outbreaks, long-term care facility outbreaks, that's changed over time. Actually, in the 5th wave, or the last 9 weeks, it actually represents 40% of the deaths that have occurred to date. Yeah, actually, I need to correct something. Earlier, I said in 2022, 87 deaths were associated with institutional outbreaks. That's not true. We've had a total of 87 deaths in 2022, and 54% of those have been associated with outbreaks. So I do need to make that correction. So when I look at the last 9 weeks, the duration of the 3rd wave to date, there's been a total of 81 deaths. 32 of those deaths, or 40% of them, were associated with long-term care facilities, outbreaks in long-term care facilities, as opposed to in wave 1, where 62% of the deaths that had occurred were associated with long-term care facility outbreaks, and wave 2, 58% of the deaths that had occurred were associated with long-term care facilities. So far, a smaller proportion of the deaths that have occurred in this wave have been associated with outbreaks in long-term care facilities. We are seeing a reduction in the number of our outbreaks. So we're down to 40 outbreaks. And just to note, we are only able to follow outbreaks in congregate settings, long-term care facilities, retirement homes, hospitals, and other congregate settings like group homes and childcare centers. So other outbreaks happening in the community, we don't have data on that. So with that in mind, we have 40 of such outbreaks now, down from 54 a week ago. And this breaks down to 6 that are from congregate settings, down from 7 a week ago, and 22 that are part of institutions, down from 27 a week ago. So we have 4 hospital units in outbreak, 9 long-term care facilities, and 9 retirement homes in outbreak, and 12 childcare centers that are in outbreak. With regards to vaccination, we continue providing vaccine, but the public uptake has actually declined quite substantially. We've moved by a single percentage point up to 51% for 3rd doses provided for those that are 12 or more years of age, up from 50% a week ago. If we look at booster doses for the population 18 plus, we're now at 55% coverage, with 72% coverage for the 50 or more years of age, and 85% coverage for those who are 70 or more years of age. And as I'd indicated, we have lots of capacity to be able to provide people vaccine. The uptake of vaccine has actually dropped quite significantly. So I do encourage people to come forward to receive vaccine. We will be able to easily accommodate people as drop-ins. For children, those that are 5 to 11 years of age, 49% in Simcoe-Muskoka have received their first dose. Once again, we have a lot of capacity at our clinics to be able to provide vaccine for children for the first and second dose. And we are doing, last week did outreach to 3 schools and had quite a good uptake at those schools. And we are looking to do more school clinics. So we'd be putting information up on our website when we have those ready to go. And they run both during the day when students and teachers can obtain vaccination, and then into the late afternoon and into the evening for members of the community, family members of these children, other children to take advantage and receive vaccination. We are continuing to use wastewater monitoring for COVID-19 surveillance, and we are finding that for 3 of the 4 communities, we've had a continuation, a stabilization at a plateau, so to speak, at a fairly high level. Detected COVID-19 in the wastewater and a reduction in the wastewater monitoring in the community of Aurelia. And our dashboard remains in red status because of ongoing transmission and reduced public health capacity to respond, as well as high healthcare system occupancy. So I want to again encourage people to come forward to get their vaccine, get a booster vaccine. And in particular, people who are more vulnerable to severe outcomes, those that are above 50 years of age or have other medical conditions that would put them at risk, they in particular would benefit from getting a 3rd dose to reduce the likelihood of transmission and reduce the likelihood of severity, hospital admission, ICU admission, or passing away. And like I said, we have a lot of capacity for people to be able to come in and get that done. And I do urge that you do so. We are concerned about the potential for a rebound in transmission for Omicron, the Omicron wave, given the science tables projections about the potential for that, the possibility of that. We've received updated guidance about booster doses for those who are 12 and 14 years of age, as well as guidance for those who've had COVID-19 infection. This is about the provision of a booster dose. And so both the National Advisory Committee on Immunization and the province with guidelines are supporting the provision of vaccination booster doses for 12 to 17 years of age for people with immunosuppressive conditions, medical conditions that would put them at a higher risk of transmission. And so actually a long list. And so we will have up on our website a link to this information. This is provincially available information as well. But the conditions are as follows. Those that are immunosuppressed, and in that case have received 3 doses of vaccine as their primary series and would be therefore eligible for a 4th dose. And this would be 84 days after having received their most recent dose. And I do need to correct myself. A week ago, I said it was 168 days. Now it's 84 days, so slightly under 3 months. Those who are being actively treated for cancer, chronic kidney disease, chronic lung disease, including uncontrolled asthma, cystic fibrosis, neurodevelopmental and other chronic neurological conditions, including epilepsy and cerebral vascular disease, diabetes, both type 1 and type 2, Down syndrome, congenital heart disease, and other chronic health conditions, including pulmonary hypertension, chronic liver disease, obesity, pregnancy, sickle cell disease or thalassemia, substance use disorders, and medical fragility or having medically complex needs, which I would admit is actually a very broad category. And also individuals who are members of the First Nations, Inuit, or Métis community. As it indicated, they would be eligible 84 days following their most recent dose, the end of their primary series of vaccination. As for the question of booster doses for those who have had an infection of COVID-19, while they were waiting after the primary series became infected, how late would they have to wait? And basically the recommendation is another 3 months, actually. This is in keeping with recommendations from National Advisory Committee on Immunization. Another 3 months following their symptoms or a positive test. And I think it would be important for people to err on the side of getting the vaccine within, the 3-month interval, the 84-day interval, if you're not sure whether or not you were infected. So we'd be recommending this 3-month interval if you've had a positive test or you've developed symptoms after having contact with a person with a positive test. Otherwise, recommending going to the 84 days after the end of the second dose or the primary series of vaccination. With regards to people accessing vaccination, whether they are, the youth that are 12 to 17 years of age with the criteria or conditions listed, what we would recommend for those individuals is that they can now book on the provincial booking system. Those that are 12 to 17, when they come to our clinic, we will ask them to attest that they are in one of those groups to receive vaccination. And we also note that walk-ins are acceptable at all of our health unit community clinics and participating pharmacies. In general, I am recommending that all people who have eligibility for vaccination, please come forward. They can do so through booking or through walk-ins at our clinics, and can also receive vaccination at participating pharmacies, participating family practices such as the Couchiching Ontario Family Health, Couchiching Ontario Health Team Clinic, Barrie Family Health Team, and select pharmacies and the GoVax bus. And we do note also that the GoVax bus is now also accepting drop-ins for vaccination. Formerly, they were requiring bookings, but now are accepting drop-ins for vaccination. Today, the province announced the availability of rapid antigen tests to be deployed for free at a variety of retail venues. And the province is actually making available a listing of those venues. They do exist throughout the province. We've had a look at our own list and find that there are many retail venues for which there's participation in this, that people will be able to access this in Simcoe, Muskoka. The purpose for their use is as follows: for people without symptoms as screening, for test to work purposes, to meet critical workforce needs in the highest risk settings, and for people with symptoms. It is important to note that for those with symptoms, the reliability or sensitivity of the test really requires 2 tests, 24 to 48 hours apart, both being negative, to be reasonably assured that, in fact, you don't have COVID-19, even though you do have symptoms. So that is an important takeaway. A single negative test would not be reliable. And at this point, I'd be happy to take questions.
Thank you so much for your update this afternoon, Dr. Gardner. We will now take some questions from the media. As always, we do ask that those who are participating limit themselves to one question and one follow-up in consideration of time. Can we start with Erica Engel from Collingwood Today? Do you have a question?
Yes, thank you. Dr. Gardner, last week you touched briefly on the future of testing and not really knowing whether it was certain that PCR testing would come back in a mass capacity. Mm-hmm. Now we have rat tests, which the province has sort of said, we know that people want to know if they have COVID, so we're trying to help out with that. What do you see the role of these rat tests being as we move forward and as the pandemic changes?
Well, the way I would see it, these would be a tool to help individuals be clearer about their status, to determine whether their symptoms are due to COVID-19 or not. With two tests, 24 to 48 hours apart, while symptomatic, both the tests being negative, they would have a reasonable degree of assurance that their symptoms are not due to COVID-19 and that could help them potentially come out of isolation. So it would have that benefit. A positive test would be a reliable indication that in fact they do have COVID-19. So that would be helpful for them to know as well, and to, I think, help with their motivation to remain in isolation and to notify contacts about their status, help people who've been contacts go into isolation and help reduce transmission. So, it helps in that regard, or it will help in that regard. What it will not do is provide us with surveillance data, because we won't have reports of these test results. So it wouldn't be able to inform the figures that we provide to the public about local transmission.
Okay, and what about the context of learning to or living with the pandemic as other provinces are lifting restrictions with more access to rapid tests that may not be, reported as you say, but will help people know? How do they play a role in that, living with the pandemic?
I think that living with a pandemic is going to be a complex matter for us going forward in time. The pandemic continues. It continues around the world. There is the potential for the development, emergence of new variants. We don't know what will come in the immediate month. We might have a continued reduction. We might have some resurgence. So we need to be careful. We need to be mindful of that as we adapt, as we change in the face of the pandemic. I would like to live a freer life, just like everybody else would. We have lost a great deal of quality of life. Many of us have lost a great deal of our livelihoods, and sadly, many have lost their lives or had their health heavily impacted by the pandemic. I think, really want the pandemic to be over. I think we need to be very careful about where things go with the pandemic. I think we need to take the things one step at a time. I certainly, in addition to looking at the local data and the science, I do look to leadership from the Chief Medical Officer of Health in the province about the potential next steps for lifting up restrictions. But I do believe we need to take it one step at a time. We will need to continue to be aware that transmission still happens, that this is still a very serious infection, that people can have very serious outcome, including death. Right? Even now, we have the highest rate of death here in Simcoe Muskoka that we've had at any point in the pandemic. So we do need to be aware with these careful, tentative steps that the pandemic is still here, and we need to take it very seriously.
Thank you.
You're welcome.
Chris Simon from the Barrie Advance, do you have a question today?
I do. Thank you very much. Dr. Gardner, just looking at the hospitalization rates today, quite high. At what point do you become concerned?
I'm always concerned about the pandemic. I certainly have been concerned about the Omicron wave, the very high hospitalization that we've seen, higher than any other point in the pandemic. Same with the ICU admissions, same with mortality. So it is very much a concern to me how things have gone. I have some degree of assurance by the overall trajectory, the downward trend that we've seen for transmission indicators, and now some reduction in hospitalization. That is a good thing, but I do believe we need to be very careful because this is very transmissible. As we open up and reduce restrictions, there is a potential for some increase in transmission. We've seen some projections from the science table suggesting the potential for an increase in transmission again. So I am ever mindful of that, and I think we need to be very careful about that. And I certainly note that our hospital system is still very heavily impacted by this wave.
Okay, and my second question is just pertaining to vaccinations. The rate, as you alluded to, has slowed significantly.
Yeah.
Are there any other tools in your arsenal to be able to maybe encourage people to roll up their sleeves and get a vaccination at this point, or are we where we are?
The most potent tools we've had is general public concern about the transmission trajectory. And so there was very high demand earlier in the pandemic when vaccines were first available. And then as the Omicron wave was mounting, there was very high demand. As that falls off, so has demand. People's level of concern has reduced. So I would say that we've lost that dynamic. Proof of vaccination was a helpful tool, but I don't think at this point it is proving to be effective for encouraging people to get a third dose of vaccine. That's not required with proof of vaccination, and I don't believe the province will move in the direction of making that a requirement. Doing more outreach can help. So we found with the 3 schools that we went to last week, we had quite a good uptake of vaccination, both among the children at the school, but then their family members as well, other members of the community. If we're fortunate, as we go forward with more of that, we'll get some older individuals as well. So we would certainly encourage that family members come out and take advantage, and those who are at a higher risk, all the more so we would advise them to come out. So that is something we can do and are doing, and using the GoVax bus to go to neighborhoods and locations in which there are higher risk congregations of individuals can help. It can help where, in the instances where you go there, it helps with that locale. It doesn't get you big increases in coverage overall, but it can help with those pockets. So in my mind, I think we're at that point. If we do see a resurgence, then you might find again that there's a renewed interest in people getting vaccination. But once again, I think we'll have to see how the trajectory of the pandemic goes.
Thank you.
You're welcome.
Mary Beth Hartle from Muskoka Region, do you have a question this afternoon?
I do, yes. I was wondering, Dr. Gardner, if you could elaborate a little bit more about not providing Muskoka specific information. Will we be getting anything?
You will. I will continue to provide a breakdown of hospitalizations by Muskoka versus Simcoe designation.
I don't think we're getting those now.
Well, I believe I gave that today, if I'm not mistaken. And what I'll do
No, I
is make
mean on the
sure.
website.
Yeah, but I mean verbally. It's easier for me to provide these
Okay.
things verbally than for us to get it up on the website, just because we do have a lag in our capacity to be able to keep up that data. We've basically got quite a backload of task data entry that we have to contend with. So getting things up on the website will lag, but I will speak to more verbally.
Okay. Thank you.
You're welcome.
Mark Claremont from Muskoka Today, do you have a question?
Yes, thank you very much. So, Dr. Gardner, what do you think of the truck protests going on right now? Do you think that that's going to help or hinder your vaccination efforts? Are people going to become more entrenched, or is it going to encourage people to say, I really should get vaccinated among those who are unvaccinated?
Well, I would say that I feel for those that are impacted by those events. And I do note that there's certainly people that are opposed to vaccination, have very strong feelings about it, and do not intend to become vaccinated. They now represent less than 10% of our population. And it's very good that everybody else has come forward to receive vaccination. We would have seen much higher numbers with regards to hospitalizations and mortality if that had not been the case. But there are certainly people who are quite convinced that they will never receive a vaccine. And we know that in the majority of cases, we're not going to be able to change their minds.
Okay. Also, regarding that Muskoka situation, do you have those numbers at your fingertips, or could you provide them, say, for the fifth wave, Muskoka versus Simcoe?
I could ask. I could ask my epidemiology team to see if we can get that.
Yeah. Also, just quickly, I understand that passports in Ontario will continue to be a requirement. Are you satisfied with that?
I believe that it is helpful to continue the passport, that proof of vaccination system, because it does help to reduce transmission to those who are unvaccinated. They're much more vulnerable to severe disease, and with that system, they would not get an exposure in those environments since they wouldn't be able to get into those premises. So it's helpful from that point of view. I don't know if it's really providing an incentive for vaccination at this time because it's been in place for quite a while. And I don't think you could claim that it reduces transmission generally because two-dose vaccination by itself really doesn't reduce to a large degree transmission. It helps protect against severity, but not against transmission. So it's helpful for protecting those who are unvaccinated from getting infected and therefore having a severe outcome.
Okay, thank you very much.
You're welcome.
Is there anyone who didn't have the opportunity to ask a question this afternoon? Oh, may I go over to the phone line? My apologies, I forgot about our phone line. Are there any questions from there today? Okay. I believe
Erica, would I be able to ask one more question?
Certainly, go ahead, Erica.
Thanks. Dr. Gardner, just further to your thoughts on living with COVID, do you think more this widespread distribution of rat tests will help move in that direction?
I think it may have some benefit in reducing transmission for those who, if it encourages people with a test showing that they're a case, if it encourages them to remain in isolation and to notify their contacts, it may be beneficial from that point of view. I think otherwise may be helpful for allowing those who have symptoms but actually don't have COVID to come out of isolation sooner. So in that regard, it would be helpful for such people to be able to live more normal lives. But on the whole, think we've got to keep in mind the bigger picture and everything else that we need to do to be safe while living with the pandemic as the pandemic unfolds. So the multi-layered approach is still needed at this time. Vaccination, most of all, third dose is very much recommended for people, and all the other measures are still needed at this time.
Thank you. And I don't know if you can answer this, but the hospital, like in your monitoring dashboard, the capacity rates have gone up a lot. Would that be at all related to the return of surgeries and procedures that were on hold?
I really don't know for sure. I do know that we've had higher hospitalization from COVID-19, but that wouldn't be the main explanation for the occupancy, and I don't know.
Thanks.
You're welcome.
Are there any other final follow-up questions from the panel this afternoon? Okay, I believe that brings us to the end of our media briefing this afternoon. Dr. Gardner, thank you so much for your update, and thank you so much to the members of the media for your participation. Our next media briefing is going to be Wednesday, February 16th. Thank you so much.
Goodbye, everybody.
Recording stopped.
Decisions for yourself. Maybe you're at a certain point in your life where it is worth it to build a memory with your family, to take $10,000 or $20,000 and go on a European trip or a Disney trip with the family or something like that. But again, you're financing it. You are paying for it. Just bear that in mind. That's all. You know,
Exactly.
Yeah, you have to make your own best choices. So I think we've covered a lot here, Mike. But again, quality of life is important. And I don't love seeing people who are struggling to stay where they are, and maybe that's not the right move for them. I agree with you, Mike, that you can turn your home into a rental, or you can certainly put a second suite on there. Yeah. But at the end of the day, I think it's important to make sure that you at least understand that there are options, what they are. And maybe the way you've been doing it has cost you more than it needed to. Maybe the conversation that you have with your loved ones, you'll realize that, well, maybe they can take a few boxes to their basement instead of leaving them at yours. It's not that someone's been inconsiderate. It's when we're in habit mode, when we're in status quo mode, we often forget to look at what other options are there.
And that is probably the best advice of all that we've offered here today is bring others, unbiased eyes on board if you can. Call in some friends that you trust, have the conversation with them. They're going to be able to see things from their removed perspective that you in the middle of it aren't going to see. Talk to your family, involve them, your children and grandchildren, bring them on board. And again, bring a professional, whether it's a realtor, whether it's a mortgage broker, a professional involved in the business who can and I don't say that as someone who's going to convince you to do this, that, or the other, just someone who's going to give you the information you need to make a sound decision that you can be comfortable with.
Yeah, with that, we do have to go to break. On the other side of the break, Mike and I are going to give you some opinion, maybe on this, maybe